Hi everyone, with my group, I decided to develop a project called Anxiety Disorder and Mental Health Problem Associated with Vape and Cigarette Usage in Medical Students. But first, let's start by talking about the context. We have data from the OEMs, which tell us that by 2020, around 20.3% of the world populations consume nicotine-derived products, and this consumption was responsible for one-third of global deaths. And regarding Colombia, by 2019, one-third of the total population, or around 16 million Colombians, had tried nicotine-derived products at least once in their lives, and 18.6% of this population was between the age of 12 and 24. And regarding cyber, the OMS reports that in 2019, around 3,001 million people suffer for in there are studies published in BMC Psychology, which highlight that being a medical students could increase the probability of suffering from anxiety by up to 15%.
And to justify why research is important, it's worth mentioning that although there are some studies linking cigarette use with anxiety in university students, none has specifically focused on medical students or on the combined use of cigarette and vapes. For example, a study in Guatemala found that smokers had more than twice the prevalence of anxiety compared to non-smokers. That gives us an idea of the impact, but the study didn't include vapers or focus on our target population. Another study in Panama showed that over 27% of students used vapes and 73 did so due to anxiety or stress. However, that study only explored motivations and didn't use clinical tools like the GAT-7 to measure anxiety levels. And here in Colombia, a study on medical students found that nearly half showed moderate to severe anxiety, but it didn't look at whether that was related to substance use like cigarettes or vapes. So, what's new in our study? It brings all of this together. We focus on medical students, include both cigarette and vape use, and apply a validated tool, the GAT-7, to measure anxiety. Plus, we do it in a local context where there is currently no data on this issue. With this research, we aim not only to better understand our peers' mental health, but also to give our university tools to develop prevention and support strategies.
In our general objective, we want to identify the mental health effects associated with cigarette smoking and vaping in the medical students. And we have a specific objectives. We want to analyze the relationship between the level of knowledge about risks and the frequency of consumptions, and to determine whether there are significant differences in average anxiety score between student groups based on their smoking pattern. And the last one, to identify the psychosocial motivation for starting and continuing to smoke and vape among students.
For this study, we chose on the descriptive, observational, and the cross-sectional design because we aim to collect information without intervening in the participants' behavior. To collect data, we will use anonymous surveys via Google Forms, which allows for quick and accessible data collection. Regarding the population, we focus on the medical student from the same university campus. We will use and the null probability convenience sampling methods, meaning that only students who are available and willing to participate voluntarily will be included. Finally, the sample size will depend on the number of responses collected during the survey period.
In our research, we use three main types of variable: a social demographic variable, constant pattern variable, and personal perception variable, as well as the GAT-7 questionnaire to assess generalized anxiety. The socio-demographic variable include email, ID, age, gender, city of residence, academic program, and current semester. And the consume pattern variable where have you use traditional cigarettes in the last 12 months? Who often do you smoke traditional cigarettes? Have you used a vape in the last 12 months? Who often do you vape? Have you tried to quit smoking or vaping? And the personal perception variables include what motivates you to smoke or vape. Do you think smoking or vaping help with the anxiety or stress? Are you aware of the mental health risks associated with smoking or vaping? And last but not least, the GAT-7 questionnaire was used, which evaluated anxiety symptoms such as feeling nervous, excessive worry, difficult relaxing, irritability, feeling restless or fearful, and depending on the answer, a score from 0 to 3 was given.
In our student, we expect to find a significant relationship between a traditional cigarettes and vaping use and the presence of anxiety symptoms in the medical students. We anticipate that students who have used this substance within the last 12 months will show a higher scores and the GAG-7 anxiety scale compared to non-users. This association is expected to be more pronounced among those who smoke or vape daily or frequently. We expect to find a common belief among students that smoking or vaping provides temporal relief. Current evidence indicates that these habits may actually worsen anxiety symptoms over time. Furthermore, we anticipate that students in clinical semester will report higher levels of stress due to hospital responsibilities, rigorous evaluation, and clinical decision making. Many may have attempted to quit smoke without success, indicating that we can expect a high levels of psychological dependence. These preliminary finds are highlighting the urgent need to target mental health and smoking cessation intervention in these people. Based on what we found, we suggest creating mental health programs for the university students, especially those in clinical semesters who deal with more stress. These programs should help students learn health ways to manage their emotions so they don't depend on nicotine to feel better. It's also important to find the stigma around mental health. Our second study showed that many students about asking for help because they are afraid of being judged. We also recommend that universities make easier for students to get mental health support without feel shame or fear. These actions could help students feel better and do better in their studies. Thank you.